The Patient Protection and Affordable Care Act, better known as Obamacare, was enacted on March 23, 2010, and amended by the Healthcare and Education Reconciliation Act on March 30, 2010. This law provides numerous rights and protections that make health coverage fairer and easier to understand, along with subsides like premium tax credit and cost-sharing reductions that make it more affordable. The law also expands Medicaid to cover more people with low incomes.
Affordable Care Act goals. The law has three primary goals. 1. Make affordable health insurance available to more people. The law provides consumers with subsides that lower costs for households with incomes between 100 and 400 of the federal poverty level. 2. Expand the Medicaid program to cover all adults with income below 138% of the FPL. Not all states have expanded their Medicaid programs. 3. Support innovative medical care delivery methods designed to lower the costs of health care generally. Improvements in healthcare. One of the improvements is that the ACA protects people with pre-existing conditions from discrimination. This is good since nearly 1 in 2 non-elderly adults have a pre-existing condition, and prior to the ACA, they could have faced discrimination based on their medical history if they sought to buy insurance on their own. Also, the ACA lowered costs for seniors on Medicare. This saved seniors more than $20 billion on their prescription drugs since the law's passage, and seniors have benefited from no-cost preventive services such as cancer screenings and wellness visits. Lastly, the ACA enhanced protections for the disabled. This means that the ACA prohibits insurers from setting coverage limits as well as from denying coverage or raising prices for pre-existing conditions.
Some changes for women in healthcare were that they were no longer to be charged more for insurance than men, and in fact, insurance rates were no longer based on gender or gender identity at all. Women were guaranteed coverage for preventive services such as birth control, mammograms, and cervical cancer screenings with no cost sharing. Under the Affordable Care Act, insurance companies are required to offer maternity coverage, and pregnancy can no longer be considered a pre-existing condition to exclude women from care. The Affordable Care Act includes routine parental care visits, labor and delivery costs, all without a copayment or a deductible. And under that act, women, children, and newborns have access to important preventive care without additional costs, preventing potential pregnancy complications.
Here are some advantages of the ACA. Health insurance is more affordable for many people. The ACA aims to prevent insurers from making unreasonable rate increases. In addition to this, they must also spend at least 80% of their premiums on medical care and improvements. Prescription drugs also cost less. Many people, usually senior citizens, are unable to afford all their medications. The number of prescriptions and general drugs covered by the ACA is growing every year because they made a promise to make them more affordable for everyone. Another advantage is that no time limits exist on care. Before the ACA, many insurance companies would put dollar limits on the amount of medical coverage that they would spend on someone, and once that money ran out, they would no longer provide services to that person, and that person would have to pay for their own medical procedures. With the ACA in place, they are no longer allowed to do this, and it overall helps many people.
Some disadvantages to the Affordable Care Act were many people had to pay for higher premium, where the wider range of benefits for patients with pre-existing conditions caused premiums to rise for people who had insurance already. You could also be fined if you didn't have insurance. And if you didn't obtain an exemption, you must pay a fine, since Obamacare's goal is for people to be insured year-round. New taxes were passed into law to help pay for the Affordable Care Act, including taxes on medical device and pharmaceutical sales. Taxes were also increased for people with high incomes. And finally, businesses with 50 or more full-time employees must offer them insurance or make payment to cover their healthcare expenses.
The Medicaid coverage gap. Another problem with the ACA is the Medicaid coverage gap. 1.6 million Americans in those blue states shown cannot qualify for Medicaid. Even though their income is below the federal poverty line, their state has not adopted the expansion to the Medicaid, which raises the threshold for qualification. Their incomes are above the state's threshold for Medicaid coverage, even though they would qualify if their state adopted the Medicaid expansion, which is adopted in 40 of the states. Of those 1.6 million people in those blue states, most of them are in the South, with Texas having around 700,000 of them and Florida having around 300,000. The reason for this difference in the thresholds is that in 2012 the Supreme Court ruled that mandatory Medicaid expansion was unconstitutional, so it basically made it optional for the states to participate in.
Trump and changes. During Trump's presidency, he did many changes to the act which weren't all good or beneficial, but he reduced the penalty for not having health insurance to $0. He expanded the use of HRAs, letting employers reimburse employees for individual health insurance policies. He also allowed states to impose work requirements for Medicaid eligibility, reducing enrollment and expenditures. And lastly, he significantly reduced funding for ACA outreach, advertising, and navigator programs that assist with enrollment.
The American Health Care Act. As we all know, in 2016 Trump won office. Along with him, Republicans also gained majority in both sides of the House. One of Trump's campaign promises was to repeal Obamacare, and this was their proposal for it. It would have majorly cut back on federal government spending by $772 billion over the next 10 years. It also included significant tax cuts for corporations and the wealthy, who were previously taxed to cover some of the costs of Obamacare. However, along with this, it was also estimated that about 24 million people would lose their health coverage by 2026. On May 4, 2017, it was put to vote in the House. It passed with 217 to 213 votes in favor, with the 217 votes coming from Republicans, while 193 Democrats voted no, along with 20 Republicans who also voted no, and there was also one Republican abstention.
After the passing of the bill in the House, protests occurred across the country opposed, where the bill failed to pass the Senate 49 to 51, where 3 Republicans went against their party and voted with the Democrats against it. The photo on the left shows protests outside Representative Rodney Davis's office.
The Affordable Care Act today. Today, 21.4 million people have an Affordable Care Act marketplace plan. In addition to this, in 2013, the number of uninsured people was 45.2 million, and more recently, in 2022, it is only 26.4 million people. Overall, there are about 84 million people enrolled in Medicaid today. Something that Biden has done with this is that he removed working as a condition for coverage, which was something that was implemented by Trump. Biden has also restored funding to some programs of the ACA called navigator programs. These allowed for people to better understand their coverage, which is something that was cut under Trump.